Who's a candidate for the light adjustable lens? It can be used for people that have cataract or people that don't have cataract. One of the biggest groups we see right now is all of the patients that had laser vision correction in the past. They now have cataract 20, 30 years down the road. Those patients, by and large, never want to be back in glasses. That's why they had refractive surgery. The light adjustable lens is the absolute best thing for them because it's so predictable. We can get them on target exactly where they want to be. Very high quality vision. A typical surgery with a standard lens, about 30% of patients need additional help. Glasses for distance, something for near. And that is inherent even with the best surgeon, the best lens as far as outcome. But literally any patient that wants to see their absolute best vision at whatever focal point, if it's both eyes distance, it's something, a little bit of monovision, we can hit that target. So be it cataract surgery, people that had prior laser vision correction that have cataract, or people that have never had surgery but have lost their ability to focus up close, can't see as well at distance, that want to dial their correction in to be relatively spectacle independent.